Good day everyone. How are you all doing? My name is Mr. Teacher and with me today is...
My name is Mom Gross. Daddy Gross sent me to represent him for today.
Before I introduce the topic for today, let us consider some fun facts you may not have known about. Muscles that stabilizes the scapula when trying to pick something away is the pectoralis minor. Boxer's muscle is the serratus anterior. The pectoralis major assists in climbing, which is associated with latissimus dorsi. Why we would tell you what makes those muscles to be related with the information provided to you on our discussion on muscles of the pectoral region. Today we shall look into clavipectoral fascia. Mummy Gross.
The clavipectoral fascia is a fascia layer in the shoulder region, connecting the clavicle, collarbone, to the pectoralis minor muscle. Deep to the pectoralis major muscle, another fascia called the clavipectoral fascia is seen. It is so named as it is clearly seen between the clavicle and the superomedial border of pectoralis minor. This fascia fills the gap between the clavicle above and the medial edge of the pectoralis below. The clavipectoral fascia is a thick, bilateral connective tissue structure deep to pectoralis major muscle. Borders of the clavipectoral fascia are: the clavipectoral fascia extends superiorly from the clavicle, medially from the costochondral joints, and superolaterally from the coracoid process. The fascia converges in the axilla, where it acts as a protective structure over the neurovascular structure of the axilla. Components of the clavipectoral fascia. Although it is a single continuous fibrous sheath, the clavipectoral fascia has been subdivided into different segments. At the most superficial part, where it is attached to the coracoid process laterally and blends with the upper two external intercostal membranes medially, it is referred to as the costocoracoid membrane. Costocoracoid membrane. This is a thin, fibrous membrane that covers the upper part of the costocoracoid ligament. It extends from the costal cartilage of the first rib to the coracoid process of the scapula. It forms a part of the delta pectoral fascia and serves as a protective covering for the underlying structures. At this level, the fascia splits and encompasses subclavius muscle, sometimes called the fascia of subclavius, and is attached to the borders of the subclavian groove. The sheath reunites at the inferior border of subclavius muscle and forms a well-defined thickening called the costocoracoid ligament, spanning the distance between the coracoid process and the first costochondral joint. Costocoracoid ligament. This is a stronger, more defined band of connective tissue that connects the first rib to the coracoid process of the scapula. It is responsible for providing support and stability to the shoulder joint. The fascia continues loosely downward until it divides again at the superior border of pectoralis minor and encloses the muscle. At the inferior level of pectoralis minor muscle, the fibers again reunite. As seen with the costocoracoid ligament, the fascia thickens to become the suspensory ligament of the axilla. Here, the suspensory ligament of the axilla is attached to the axillary fascia that forms floor of the axilla. Functions of the clavipectoral fascia are: the main role of any fascia is to allow smooth movement of adjacent structures over each other. The clavipectoral fascia is no different, in that it permits the gliding of pectoralis major muscle over pectoralis minor muscle. Furthermore, the suspensory ligaments of the axilli exert tension on the floor of the axilli, resulting in the trademark concavity commonly called the armpits, seen most when the arm is abducted. Located inferior to the costocoracoid ligament, medial to the coracoid process, and superior to pectoralis minor. In the substance of the costocoracoid membrane is an opening through which two structures enter and two structures leave the deep compartment of the pectoral girdle. The cephalic vein enters from the arm to join the axillary vein, and lymphatic vessels from the infraclavicular nodes pass through the hiatus to join the apical nodes of the axilla. The lateral pectoral nerve, branch of the lateral cord of the brachial plexus, and the thoracoacromial artery, or its branches, acromial, deltoid, pectoral and clavicular, branch of the first part of the axillary artery, exit the deep compartment of the pectoral girdle to their respective muscles.
Wow! If you are indeed mummy gross. Hopefully we get to have you more often. Before we go for today, the clavipectoral fascia is formed by the fusion of two layers. 1. The pectoral fascia, deep layer. 2. The clavicular fascia, superficial layer. It's a vital structure in various medical contexts, including 1. Surgery. Understanding the clavipectoral fascia is essential for surgeons performing procedures in the axillary region. 2. Anatomy education. Knowledge of this fascia is crucial for students learning about the shoulder and axillary region. 3. Clinical examination. Familiarity with the clavipectoral fascia helps clinicians diagnose and manage conditions affecting the shoulder and axillary region. 4. Imaging interpretation. Recognizing the clavipectoral fascia is important for accurate interpretation of imaging studies, such as MRI or kinetic CT scans.
Please try to subscribe and drop any questions or topics you want us to cover on the comments section.